It has been 5 years today since the first cases of COVID-19 were diagnosed in our province. And according to data, as you might have heard of this in the news, data up to last week, March 6th, the virus has contributed to the deaths of almost 4,000 Manitobans. 63-year-old Valerie Alderson says her 82-year-old father, Lloyd Hodgins, died from COVID complications within days of going to a hospital for a broken hip. Here's part of her story today.
My father was in the care home and had fallen and broken his hip, was transferred to a local hospital and diagnosed and confirmed that he had a fractured hip, sent to a second hospital for the surgery. And at that time, the guidelines from the hospital were you had to wear a mask and you were only allowed a 30-minute visit each day. And so there was my sister and I, but we couldn't visit together. We had to visit separately. I'd seen him on Saturday. He was declining. He was just not himself. My sister had seen him, and then they did the COVID test and determined that he had COVID. And because of being in the nursing home prior to that, the nursing home has a do not resuscitate. So they transferred him to the unit that was managing people with COVID. And then he died early Monday morning, all alone, without anybody. I was upset about the process. Like, both my sister and I were vaccinated. We could have had our masks on, visors on, gown on, gloves on, be with him. But like any other facility that had a loved one that was passing away due to complications of COVID, the only people that were to be present on those units were the staff members. We are one of many families that have gone through that. It'll always be a part of who you are, what you had gone through. And at that period of time, it was so much was unknown. And everybody was trying to scramble to get things into place and try to protect the public and try to protect the healthcare workers. And I think we should have put things into place. If someone brings up the topic about the COVID, well, then it's a flashback. Got to take care of myself now. So I have more years behind me than I have ahead of me. I always think it's important that when you have a loved one go, like whether it's your parent, your sibling, it's important for someone to be there, whether it's to hold their hand, to wipe their face, to sing a song, to read poetry, whatever, because the hearing is the last thing that goes on any person that's passing away, and then they're gone.
That's Valerie Alderson. She lost her father due to complications with COVID. We're talking all about COVID today because we're at the 5-year mark of the first 2 cases diagnosed here in Manitoba. So continue to share your thoughts, memories, how your life has changed, what we've learned or not learned as a province on our listener line, 788-3205. Well, it wasn't long after the first infections that long COVID symptoms then started to surface. Health professionals knew very little about the impact. So a group of data scientists and doctors at the University of Manitoba started collecting and studying health data to learn more. So let's find out 5 years on where they're at. Dr. Katz is with us via Zoom live on CBC, health sciences researcher and family physician at the University of Manitoba. Good morning.
Good morning, Marcy.
Just because I saw you listening to Valerie's story, I sort of saw you absorbing this. I'm wondering what you're thinking about today, on this 5-year significant anniversary in our province.
Yeah, we all lived through a terrible time, and that story is just so heartbreaking. And it's not a unique story. It's not an unusual story. It's a very common one. Many people suffered numerous consequences and loss during that time, particularly family members. What happened during personal care homes, not just in Manitoba, but across Canada, was just heartbreaking. And we really need to learn the lessons of the humane aspect of caring for people, not just treating and looking after a disease. We're looking after human beings with emotions and needs. And I think we need to learn those lessons for future pandemics.
When it comes to your data for long COVID, I want to turn to your study. Tell me first, what are the symptoms of long COVID? And 5 years later, what have you learned?
So, long COVID is a syndrome, a condition that starts by definition about 3 months after the positive test for COVID, for the virus. So symptoms that occur in that first 3 months after infection are not really regarded as part of long COVID. They're still part of that initial infection. If symptoms persist beyond the 3 months, we're talking about fatigue, just devastating fatigue. People who actually struggle to get out of bed at all in the morning. It really makes life incredibly hard. But that's just one. Inability to think clearly, what people often call brain fog, shortness of breath, cough, headaches, irregular heartbeats, diarrhea. There are no system in the body is spared from long COVID. The study that we did, we looked at over 200 symptoms because those were all in the literature described as being associated with this initial viral infection and that the consequences of that.
How many people did you study, and what demographic did you find was most at risk for long COVID?
So we looked at over 66,000 people in Manitoba who had positive COVID tests. We found that about 23% of them, more than 1 in 5, almost 1 in 4, had presented to a healthcare provider with these symptoms, new symptoms, 3 months after their infection. So that's not an uncommon event. That's a concern. And older people were much more susceptible. People who had other illnesses, other diseases, made them more susceptible. Women were more susceptible. And people who had vaccines were protected. So that's the good news in this, that vaccines don't necessarily totally prevent any infection, but they prevent severe infections. And people with more severe infections who landed up in hospital were also much more likely to get long COVID.
What kind of clinics right now do we have in Manitoba then to treat long COVID? Where are we at with the treatment?
So, Marcy, the treatment of long COVID is very complex, and there are no single treatments. It's not like there's a drug to treat any one of these conditions by itself or as a group. So there is no single long COVID clinic in Manitoba, and although there are some clinics in other provinces, long COVID is less common now. People are vaccinated. Most folks have either been vaccinated or had an infection at some time in their lives. So if they do get an infection, they're much less likely to get long COVID now. And that's our research and other research has confirmed this. So there is no single long COVID clinic in Manitoba other than a clinic at the Misericordia, which was around physiotherapy, helping people with their rehabilitation. But most of the resources are online, where people can go online. There are some very good online resources that Shared Health will direct people to. And then it's a matter of going to your family doctor, to a rehab specialist with the advice and following through. But there is no single long COVID treat-all place.
Do we know if the long COVID symptoms, those who did have long COVID symptoms, if they got better? Like, do we have a sense of that yet, or if some of the symptoms got better or lessened? What do we understand about the longevity of long COVID?
Yes to all of those. So the reality is that some people get better and some people get better quite quickly. Some people really struggle, and 5 years on from the initial beginning of the pandemic, we still have a number of people whose lives have been devastated by long COVID, who suffer every single day. And those are the minority. There are not a lot of them, but for them, they're one of one. They are living this every single day, and it makes life very difficult for them. You know, one of the things that the chief science officer of Canada put together a task force of us to look at long COVID, and I was privileged to be asked to be part of that. And one of the challenges we faced is that there was no definition of long COVID. So people who lost their jobs, they can't go to work. There was no way they could get insurance benefits for that. Things like that, we've come a long way. Those kinds of things have been explored, and I think there are some things in place. But this is not just a medical condition with symptoms. It affects every aspect of people's lives when they still have these severe long COVID symptoms.
What needs to change to help people still living with long COVID symptoms, in your view, in terms of our healthcare system?
I think it would be good if we did have a one-stop shop where people could at least contact the healthcare system and say, I've still got severe symptoms. Where should I go? What should I do? It doesn't necessarily mean setting up an expensive clinic for the system. It just means recognizing that people are still suffering, and where can they go to get their particular symptoms best treated. Some of those symptoms are about anxiety, for instance. So going to a medical clinic, drugs is not the best thing for treatment of anxiety. There are other ways of treating for anxiety that are more effective. And so we need to think about that. In our system currently, psychologists, for instance, are generally not covered by Medicare. So maybe for people with long COVID with severe anxiety because of that, there should be a way of getting them care that is covered by Medicare. This is not a simple thing, but I think there are things that we could do to make the lives of people who are severely impacted easier.
Thank you very much for being with us today. Really appreciate your perspective and you telling us about your research.
Thanks for having me.
That is Dr. Alan Katz, a health sciences researcher and family physician at the University of Manitoba.